The pharmaceutical industry is making a fortune off of statin drugs, cholesterol medicine, because they've convinced you, the public, that high cholesterol causes heart attacks. And that paranoia makes you, when your cholesterol is high and the blood test, say, oh, okay, give me the stuff, right? And then you end up on statins. I think it's significant to note that back in 1901, there was a German chemist, and he was commissioned to come up with like this lubricant oil for engineers in submarines. Now, it didn't really work out because submarines is such a small market. So he sold the patent to Procter & Gamble, the corporation. They took the patent and they tried to make soap with it. But at the time, in the early 1900s, households made their own soap. So soap was not a big seller. So they're like, all right, well, that didn't work. What are we going to do with it? Well, they had this guy on their board of directors named Ancel Keys. He was a scientist. He was also on the board of the American Medical Association, the AMA. He brokered a deal to have the AMA back Procter & Gamble's new product, which was made with this patent oil, and they called this product Crisco. Crisco, you remember Crisco? And so the AMA made $1.7 million from this deal, which was a lot of money back then. So the AMA backed it, they co-signed it, they promoted it, and together, Procter & Gamble and the AMA and Ancel Keys as himself, because he was popular, think of Dr. Fauci now in recent times. And they went out there and they demonized saturated fats. They demonized cholesterol. And they said Crisco was a better option and that animal fats was the cause of this heart disease. And it worked. Everyone started eating Crisco. When statin drugs did finally come out, which was in the late 80s, the American public was already conditioned to view cholesterol as the boogeyman in the closet. So it was an easy sell by that point. And then all the fat-free products came out. Fat-free cottage cheese, fat-free milk, all these fat-free. And then people started using margarine instead of butter. And these food corporations, they don't care about your health. They're looking to make a buck in the moment while something's hot, right? And so we get into the 90s, the 1990s, and now they're selling, you see the word cholesterol on Cheerio boxes. And grains started being pushed heavy. Oatmeal, good for your heart. Things like this. And a lot of this comes from this deal that happened between Procter & Gamble and the AMA, facilitated by Ancel Keys. We were absolutely programmed, and when the time was right, boom, the drugs and the products came out. Before you know it, Americans were suffering with low testosterone issues, infertility, hormonal issues. Women were going into menopause earlier. Women were going into menopause in their 60s and 70s. Now they're doing it in their 40s and 50s. Of course, the big one that popped up was Alzheimer's. And so these things are from fat deficiencies. But ultimately, I think the big point is that heart disease never went down. Heart disease is the biggest killer in America right now, at the time you're hearing my voice. It's been like that for decades. We have a heart attack all the time, Americans do. So obviously, this cholesterol thing didn't work. It's been proven faulty because it hasn't helped. It's clear as day. All right, so now you know the story and you can understand the concept. Now we got to jump into the science. Your liver makes cholesterol. It's an alkaline substance. It's a waxy, sterile substance. And it makes up stress hormones, cell membranes, 75% of your brain, myelin, which is insulation of nerves. And so you need cholesterol for all that to happen. When you go on statin drugs, it creates inflammation of the liver purposely, which halts the body's production of cholesterol. So essentially, if someone's on statin drugs and they're eating a low-fat diet, their cholesterol goes way down, way into the gutter. That is not a good thing. You don't want your cholesterol to be that low. Cholesterol deficiency can cause up to 25 different so-called diseases, including the most famous one called Alzheimer's. So cholesterol is transported through the body by what's called lipoproteins, and we know them in three categories: HDL, LDL, LVDL, and the only difference between the three is the size. There's all these acronyms and things to remember: the good cholesterol, the bad cholesterol, you know. So here's what you need to know, okay? Lipoproteins are vehicles on the road. Inside the lipoprotein are passengers. That's the cholesterol. In other words, cholesterol can't go into the blood directly. It just doesn't mesh biochemically. So it needs to be carried by these vehicles called lipoproteins. So the cholesterol itself doesn't cause the obstructions. It's the lipoproteins or the vehicles which can create the obstructions, which is just like a traffic jam on a highway. And then you have to say, how big is the car, the vehicle? When it comes to cholesterol, we measure this by the size of the particle. A lipoprotein is considered a particle. So using our analogy, you might have a Prius, and then you might have a big truck. You know, you got truck drivers going down the road carrying cargo, but their vehicle's too big. They can't enter the arteries. Or in this analogy, you could consider it a tunnel, I suppose. This particular truck is too big to enter a certain tunnel. So it's the small particles, the small vehicles that are causing the traffic jams, which is why they consider LDL, low density, in other words, small, to be bad cholesterol. Now, how do we measure this? In the blood test, basically, if you have high LDL, which is the quote-unquote bad cholesterol, that means you have free radical damage. And if you read the Peace Over Pain book, I taught you about free radical damage. And we know where it comes from. It comes from being on the poor four foods and or pollution and things of this nature. We have to neutralize that with antioxidants. And of course, getting off of the poor four foods. You stop the bleeding. Not only does free radical damage cause inflammation in your arteries, but so doesn't sugar. When you can't metabolize sugar properly, the membranes of the walls of the arteries start to harden and inflame. Blood sugar issues are mineral deficiency. When you're lacking 2 particular minerals with 23 cofactors, then you can no longer metabolize sugar properly. And that's what causes this. If you talk to most people who have quote-unquote heart disease or cardiovascular disease, you will find that most of them have been diagnosed by the medical monopoly with prediabetes or full-blown diabetes, type 2. It is no accident. They are deeply related. My dad is a perfect example. He had open heart surgery at 48 years old. He was diagnosed with type 2 diabetes about 5 years before that. He was also told that he had prediabetes back when he was in his 20s. Now, he's in his mid-70s and he's on dialysis. So there's a spectrum here with the blood sugar issues. And of course, they put him on statin drugs as soon as it came out in 1987. Say, hey, sir, this will help you. But it didn't. He still had a heart attack. He still had open heart surgery. And, you know, he is the role model of this baby boomer generation that's been scammed. So if you have a 5-year-old that bounces off the walls like super ADHD, you can make a case that they have an early onset of diabetes. It's on a spectrum and it takes time, and eventually you get the diagnosis, which is almost always paired with cardiovascular disease and high cholesterol. Why? Again, the body in its wisdom wants to put out the fire. The fire is caused by free radical damage or a lack of metabolizing sugar, and the body shoots out alkaline cholesterol to plaque on the arteries, like putting putty on a wall. It's just trying to solve the problem. And the body also does it with another alkaline substance, which is called calcium. And that's a whole other video training. So LDL, especially LDL-P, LDL particles, are a marker for free radical damage, which creates inflammation. Because the liver, which makes the cholesterol, is shooting out, it's releasing cholesterol to put out the fire, because cholesterol is alkaline. So if you have free radical damage, your body in its inner wisdom is trying to put the fire out. And it can put the fire out with cholesterol. And so it needs to put out LDL because it's lower, smaller, so it can get into the arteries and put out the fire. So it's trying to save you. Cholesterol itself doesn't cause a problem. It's just a marker. It's an indicator that you have a problem. When you see your cholesterol score on your labs, that's more of a nutrient. That's no different than checking your vitamin D levels or your B12 levels. So if your regular cholesterol score is low, then you might be heading towards a brain health issue or a hormone health issue. That's essentially dietary cholesterol. This is what we get from butter and eggs and meat, which if you're eating those, make sure they're organic, grass-fed, cage-free, etc. That's just a side note. But cholesterol is needed to come into the body. The more cholesterol you put into your body, the less the liver has to work. So if you're doing what you're supposed to be doing, if you're working with me, if you're my client, all my clients are off the poor four foods. That's number one. And then you got to raise your antioxidant level, which we do with an ORAC score. When you start bringing in a high ORAC score, you can start neutralizing and putting out these fires. And the liver can chill out and not have to go through all this work creating cholesterol that it needs. You know, the extra cholesterol. So when somebody has not enough cholesterol going in through their mouth, the liver has to do more work. And we typically see this with a lot of vegans and vegetarians who just aren't eating enough avocados, nuts, and seeds. Or we see this with someone who's been advised by their medical doctor to go fat-free because the medical doctor is giving bad advice. As far as cardiovascular disease goes, there is a marker in the labs that indicate if you have that traffic jam. The marker for that is called APOB. APOB. Most medical doctors don't even order this test. Remember, like I taught you in the Peace Over Pain book, medical doctors are soldiers that follow orders. So they're very restricted. The insurance companies have them by the tail. So sometimes they get stingy with ordering your lab work because it costs more money, and the insurance companies yell at them. They get in trouble. So you have to ask for an advanced lipid test. It may cost you more money, but it's worth it. Get an advanced lipid test so you can see your APOB. And that stands for apolipoprotein B. What a word. Apolipoprotein B. Now, there are some other biomarkers that can indicate heart disease. Homocysteine levels, CRP, C-reactive protein, highly sensitive CRP. A calcium scoring test is a great way to know as well, and of course echocardiograms. There's also NP, which assesses an acute type of situation with the heart. But these are all indicators to see what's going on, not just cholesterol. So there's something else on your labs we have to talk about, and that's triglycerides. Triglycerides are a type of fat found in your blood that when you eat, your body will convert calories it doesn't need to use right away into these triglycerides. They're stored in your fat cells, and then later on hormones release triglycerides for energy between your meals. If you have high triglycerides, there's so many symptoms that can occur. One of them is pancreatitis. I had a client back in the day who had pancreatitis, and she had a piece of it removed before she ever even found me. So I was, I had to work with her, basically with a not so functional pancreas, but she had pancreatitis and her triglycerides were through the roof. And we got those down and she started feeling better. But this is, your liver, your spleen can get swollen. Triglycerides is something you want to keep. It's not like cholesterol. if you have high cholesterol, there's really no symptoms because high cholesterol is a marker. It's more of a marker for other things. Whereas triglycerides, if you have high triglycerides, you're going to have some symptoms that come along with that. A lot of times triglycerides can be a essential fatty acid deficiency. And so I've seen a lot of medical doctors get confused because you take someone who, their LDL might be a little high, their regular cholesterol might be pretty normal, and then their triglycerides are normal, and the doctor can't figure it out. He's like, because right, in a normal, unhealthy person, the triglycerides are high as well as the LDL. So how can the LDL be high, but the triglycerides be low? But a medical doctor doesn't understand clinical nutrition, you see? Just like I described in the Peace Over Pain book. So this individual that I'm using as an example would more than likely be a victim of a lot of free radical damage. They're inflamed. But their triglycerides might be high because of nutritional deficiency. So there's a lot of context that goes into these labs. You got to know how to read them in order to decipher it. You don't want to rely on your medical doctor. If you're relying on him or her, you're at their mercy of their own particular interpretation. Another interesting thing that, Dr. Wallach has said from doing thousands of autopsies is that arteries get clogged where they bend, not where they're straight. In other words, cholesterol is never a problem in the veins because the veins are typically straight. It's just the arteries when they bend, when there's a curve. So when someone comes to me with high cholesterol, they're usually freaked out because the doctors scared them, of course. But I can tell you right now, if you're on statin drugs, it's very hard to correct the body while you're on statin drugs. There's 2 drugs that I talk about in the Peace Over Pain book that make it very hard for holistic doctors and practitioners to help you, and statin drugs is one of the 2. So it's a big decision that you as a person are going to have to make. You're going to have to pick who you trust, But I tell people all the time, I'd rather have high cholesterol than low cholesterol. Oh my goodness. Now you're susceptible to a brain disease like a dementia and Alzheimer's. Because your body produces 3 to 4 times more cholesterol than you can actually eat. So the production of cholesterol increases when you eat low amounts. And your production of cholesterol decreases when you eat high amounts. Another sign is liver spots. The liver spots, those golden brown spots you see on older folks usually? If you see those, there's even more inside you. Never mind your skin. This indicates that you have a high risk of dementia, cataracts, cardiovascular disease, cancer, etc. And it's a cholesterol thing. So just to start wrapping this up, if you have high cholesterol, that means it's a marker. It's telling you, it's an indicator, it's a red light in the car saying, hey, you have free radical damage going on in your arteries, and or you're not metabolizing sugar properly.
Have you read Peace Over Pain yet? This short but powerful book reveals how to eliminate chronic pain and or illness faster than any other known therapeutic approach. Download the Peace Over Pain book for only $4.95 and gain instant access to the ebook version, audiobook version, and a video training with Dr. Reese. Go to peaceoverpain.com and start reading or listening right now. This is the information you've been praying for.